I have Dr. Tyler Murphy, an internist and lifestyle medicine specialist with Holland Hospital here with me. And Dr. Murphy, I know we've been discussing long COVID. If you can start for me, just kind of explain what long COVID is.
Sure, long COVID just is really COVID symptoms lasting longer than 30 days. It's an arbitrary definition, but we had to start somewhere.
Is there any way, or what is the best way to prevent long COVID from happening?
So the best prevention is to not get COVID in the first place. And studies have recently been published that show vaccine status correlates best with the likelihood of long COVID. So if no vaccines have been given, about a 40% chance at long COVID. One vaccine, it's 30% risk. And if you have had 2 or more vaccines, your risk for long COVID fall all the way down to 15% or less.
Is there anybody that's more at risk for long COVID?
So those who are most at risk for long COVID really are the same who are most at risk for more severe COVID infections. So those of higher weight and more chronic medical illnesses. Another factor that seems to correlate very well is the severity of the COVID infection. So more severely affected individuals, those who are hospitalized or even managed in the ICU, will have a higher chance of long COVID symptoms. But let me emphasize that even with minor illness, there can still be a chance of long-lasting COVID symptoms.
Talk to me about some supplements. We've heard that possibly zinc or some other supplements may either prevent COVID or assist in the symptoms that you experience from long COVID. What do you all know at this point about those?
So long COVID is really an active area of research, so we don't know a lot right now. There's certainly no evidence that any vitamin or supplement expedites the recovery from long COVID or reduces the odds of it happening. But that being said, there's a lot of benefit from supplements to the psyche. And so at times, the idea that somebody's taken an active involvement in their own health sometimes confers better outcomes. So I often encourage people that if you're trying something and you feel like it's doing something positive, there's probably not going to be anything wrong with it. The 2 main things I would avoid would be megadose vitamins and absolutely no intranasal zinc. We know that can lead to permanent loss of smell.
Now, if someone was to find themselves with long COVID, are there any sort of things they can do to maybe expedite that healing process or at least assist with it?
Again, as we live alongside of long COVID longer, I suspect there'll be really good guidance in the medical literature eventually about how to approach long COVID. Again, currently no FDA-approved medication therapies or supplements to recommend, but for like many things in health and wellness, the healthier your body is coming into something and the healthier it is in the midst of something, generally speaking, the better off that's going to be. And so with regards to keeping the body healthy, there are a number of things one can do with their lifestyle habits to promote a greater sense of wellness. Let's also point out that time is probably the best healer for long COVID. At the 3-month mark and then 6 months and 12 months, long COVID symptoms tremendously fall off. So again, doing nothing, just time alone, will get most people through their condition of long COVID. Potentially supporting the body with healthier lifestyle habits, better nutrition, sleep, fitness, avoiding chemical exposures, managing stress. These are all additional things one can do to potentially help expedite the recovery from COVID.
I know you spoke about nutrition, getting the proper sleep. What are some specific things people can do when it comes to making positive lifestyle changes?
So the more food comes from plants and in whole and formed, so fruits and vegetables, whole grains, nuts and seeds, beans and lentils, and the more one avoids processed foods, sugar-sweetened beverages, meat, dairy, and eggs, the more optimized that nutrition pattern will be. That's going to help the body be full of the vitamins and the minerals and the fiber and the food medicine that it needs to fight against any disease state that it has. In regards to sleep, The sleep requirements might be a little bit higher when one is recovering from an illness. So trying to get a minimum of 8 hours of restful sleep a night, maybe even 9 when you're in the more active stages of your long COVID. Also trying to minimize the amount of energy going to other things within the brain. So having a very peaceful and calm brain, one that is supported through meditation and or yoga or other mindfulness activities. Again, that's going to allow for more resources in the body to be used for fighting the symptoms of long COVID, less that it's going to be devoting toward, perpetuating thoughts and distress and other malproductive behaviors of the body.
Dr. Murphy, are there any other lifestyle habits or changes that people can make when it comes to long COVID?
Besides, supporting the body with optimal nutrition and sleep, moving the body in a healthy way. So, it may be difficult to do your normal exercise regimen when you're having those symptoms, but something is better than nothing. So a serene walk in the park, low intensity, repetitive motion, just a walk or a light row or swim or elliptical machine, a light bike ride. So less intense exercise, more lower impact, might be lower durations. And then avoiding poor chemicals, substances that we take sometimes to cope, alcohol, tobacco, marijuana, certainly avoiding other illicit drugs, but just trying to be very clean in one's eating, exposure to chemicals through personal care products. So just being more simple, being more natural. Again, it's going to be less distraction for the body, less things to detoxify, allowing the body to devote more resource to the work of healing.
Wonderful. And I know we were discussing your own experience with patients that have long COVID. Can you just tell me a little bit about that?
The good news is the majority of my patients who've had COVID symptoms lasting longer than 30 days, those symptoms have been rather mild. They've still been able to live alongside of those symptoms. Again, maybe just with some additional support of those healthy lifestyle habits, that could just make the experience even a little less unpleasant. Have had some patients have more severe symptoms to where they couldn't work or participate in their normal life activities. And so in those persons, I've recommended our lifestyle medicine clinic through Holland Hospital, and or the rehabilitation department offers a long COVID rehabilitation program. Again, both of these approaches would take an interdisciplinary approach to just supporting one's return to health. So mainly being positive, encouraging, helping people institute good habits and other preventive measures just to support the body's return to health as quickly as possible.
And Dr. Murphy, for those sitting at home that may not be finding relief, can you just talk about some of the options that are available to them?
Sure. My hope is, for those persons, first of all, I want to offer a hopeful message that time alone is often the best healer, and so there's a great likelihood with the right amount of time, those symptoms will improve. However, if you're looking for additional expedition of those symptom recoveries, again, that can be done in a self-directed way through following some of the advice given here today, or it can be done in a mentored, guided way. We're happy, obviously, to see you in our lifestyle medicine clinic, or certainly give the rehabilitation services of Holland Hospital a call. Obviously, involve your own personal physician too, because they might have experiences and resources to direct you about as well. Certainly don't suffer alone.
Thank you, Dr. Murphy.
Glad to be here. Thanks for having me.